everyone, and thank you so much for tuning in to KBTV. I'm Dr. Karlisha Booze. For this week's Wellness Wednesday segment, we're highlighting Piedmont Macon. Piedmont Macon has been named a 2021 America's Best Rehabilitation Center right here in Georgia by Newsweek magazine. That's a big deal because they've been recognized for the closest within the 50-mile radius. And today I'm joined by Tyrone Richardson. He's a physical therapist assistant at the Piedmont Macon. So hello, Tyrone, and thank you so much for tuning in and joining with us, KBTV.
All right, welcome. Good morning to you. Glad to be here.
Absolutely. Thank you. So I do know you guys were recognized for the quality care, the reputation, and accreditation. Why do you think you guys were recognized for that?
I just think as a therapy, I think we offer great quality care. I think as a group, we work very well together, from the doctors all the way down to everybody, from the whole staff included, from the cleaning crew up to the doctors. I just think we all just work together and strive to get the patients back to where they want to be at, try to reach the goals that they want to achieve and do it in a fun and innovative way. So then that way it just makes it just a great environment for the patient.
Okay. So speaking of that quality care, what are some services that you guys offer at your facility?
Services we offer physical therapy, occupational therapy, speech therapy, and therapeutic recreation. And with the physical therapy, I'll talk a little bit more about the physical therapy aspect of it, since that's where I work at. Just really getting patients back up and on their feet again. Just working on strength, working on balance, working on being able to get to the ability to walk and to really assess gait, which is the process of walking. So then that way we can get the patient back up and get them as independent as possible. The occupational therapy aspect works on what we call activities of daily living. So getting in and out of the kitchen, working on grooming, working on dressing, all of that stuff that we kind of take for granted when we're not sick, really.
Right. So let's talk about patients who just getting back in the groove from maybe an injury during sports or an accident. What are some at-home exercises that you recommend that they could do?
Okay, as a physical therapy, my exercise I like to do at the house, which is free, is getting up and walking. Whether we can clear out a hallway, what we call a walking program, just getting back up, building up your strength, building up your endurance and stamina. And with that process, you can walk from, basically like an interval training until you build back up, walking from 1 minute and then resting for 2 minutes. And then, the next week, going from 2 minutes to 4. And you can really modify that to work where you're at as far as your fitness level. With all things, consult your physician regarding doing any type of, exercise program at first. But the main thing is whatever level you are, modify it. So that way you can go from where you're at to building up.
Okay. Now, obviously, we're in a pandemic. A lot of people, unfortunately, have been hospitalized due to COVID-19. Let's talk about the patients who have been hospitalized for maybe weeks. What are some activities or routines that they could do just to get their body back, almost back to normal after being hospitalized for quite some time?
Gotcha. So main thing we want to do is, like I said, the same thing process, just getting up and getting moving. Every 30 to 45 minutes, at least try to stand up, get the circulation, try to stay out of bed as much as possible, try to, get up to use your core muscles, which you are using those sitting up in the chair. One other exercise I love to do with patients is just doing a sit to stand, just standing up and sitting down and doing that 5 times, just about every hour or so. That also helps to improve circulation. We're working on, those big major muscle groups. And like I said, same thing with that, modify it to where you're at. If you're able to do it with no hands, that's great. If you need to use your hands, that's fine also. But the main thing is just trying to get up and move a little bit. If that right there is if you're not at that level, at that stage right there, doing some simple, what we call leg extension exercises, ankle pump exercises, just helping to increase that circulation, increase that joint movement. So that way, we're working that process of getting back up to that level that you were at prior to your,
Okay. Well, thank you so much, Mr. Richardson. Real quick, where can people go just to get some more information and possibly, getting those referrals to your facility?
With all things, I refer everything to their primary physician. Go through that route with it. We have a great Facebook account that you can look on that, our social media account. But also, hopefully, as the quality of care right here, just going into the community, talking to your neighbors. Just whatever it takes to get you back to where you want to be at.
All right. Well, thank you so much. And thank you guys so much for tuning in to Carly BTV. We'll see you next time.
Hey, are you experiencing algae, mold, dirt, or pollen around the foundation of your home and your driveway? If so, call Reed's when you're in need. Reed's Power Washing Service has next day service available. Select service less than 2 hours. You're thinking, Reed's Power Washing Service is homes, that's all we do. Nah, we do it all. Driveways, fences, porches, and we clean your rides. So call that number on your screen today and get you a free quote.